Good afternoon, it's Paul here. What we're going to do today is have a look at neck pain. So we're looking at our next series of exercises which will all around neck, sitting posture, neck pain, shoulder neck problems, and really diving into that sort of area of the body. What we're going to do today is have a look at neck pain and what other factors might be driving it. And so in this instance we're going to look at the shoulder and how maybe your shoulder could be creating your neck problems. Obviously in the current climate, a lot of people working at home, a lot of people working at desks that they're not used to, sitting at kitchen tables, etc., changes our sitting position over the course of a longer period of day can have different effects and different stresses on the neck. So let's have a little look. So here's our spine that we've got. If I flick around, you can see we've got this nice normal curve of the spine. The area that tends to create quite a lot of problems is around that C4, 5, so just above the one that I've highlighted green. Tends to be an area where you can put more stress through the neck. So what we're going to look at is what else can be causing problems here. Now, you'll note on here we've got your shoulder blade, and your shoulder blade, as we add in the muscles, you will see quite a lot of the muscles that actually cross between the shoulder blade, which is still highlighted in the green, and the spine, and go up and through, up into the neck. And the one that I'd like to point out today is the levator scap muscle. The reason that this is key, as you can see here, it attaches onto the top of the shoulder blade and goes up and around deep up into the neck area there. Why is that important? It's actually a big muscle in terms of lifting your shoulder blade up or hitching it up. Now, unfortunately, when we're sitting at desks, we tend to let our shoulders drop from that neutral position. Our shoulder blade is very well designed to sit in a midpoint. If I take the muscles off again, the shoulder blade should sit in a nice midpoint where you're going to find the tip of the shoulder is slightly higher than the central point, and the shoulder blade sits and is slightly wider at the lowest inferior angle as it is at the top, so it's sitting slightly out. Now, to hold in that position, we use these muscles around our shoulder blade and around our neck to help control that position. If we get into a point where we're constantly sitting in an extreme shoulder position, it can have a corresponding effect on our movement. So when we look at the muscle again, the levator scap, what tends to happen with that is if our shoulders drop, so this lateral tip comes down, our shoulders are slightly slumped, maybe slightly rounded and slumped, we'll tend to find that we're putting a tension on this area here. And that can actually create quite a lot of pain, quite a lot of problems. And there's quite a simple way to look at whether this is causing your pain and driving what is yours feeling as your neck problem. So what I'm going to get you to do at home, a very, very simple movement. I'm going to get you to just lift your elbow with your opposite hand and just hold it up in the air and try and let your arm relax as much as possible. This will take that muscle off tension. If we take that off tension, what's your neck movement like? If you look away and towards, what's your range like? What does your pain feel like? If you go ear to shoulder and if you go away, what's your movement like? Does it decrease the pain? If we have a look, sit where you feel relaxed and do your movement, lift up. Can you get more movement? There's a fair chance if you can, and if your pain is decreasing, that actually your shoulder blade and the position it's sitting in on a day-to-day basis is driving a lot more of the pain and stress that's happening in your neck. Because of the restriction that's being created by the muscles, your neck is being asked to do more work and take on more load. If we can decrease that load, then the pain frees up and the movement improves. It's a soft tissue driven issue and we can really start to work on releasing that. So I'm going to go through now into the gym. I'm going to show you a couple of very simple exercises just to start to try and help manage symptoms. particularly to break up your day. Spending long periods of time sitting in front of a computer is not going to be great for neck problems, so we do need to move. We've got to try and break our day up. So it's good to get into habit of regularly changing your position. But let's go and have a look at those 2 exercises and hopefully help you start to manage your symptoms on a day-to-day basis if they fit into this model, and lifting your arm up clears and improves your neck pain and your neck movement. If it is this shoulder position that's driving your neck pain, and you find that when you hitch the shoulder up and hold it up, that movement improves and the pain decreases, we're going to use this just to do a trigger point on it. Now you can use your fingers and just use the weight of your arm and hold, but you're just coming on to that muscle, absolutely as I just described earlier, and just hold, and you're just going to just gently pull down, and you'll hit that trigger point. It will just be like an exquisite pain in that area that will slowly dissipate and release as the muscle releases. What you should find by doing that is that then when you take it off and you do your movement again, you've improved the movement, you've decreased the pain. So that's a nice way to address just the pain side of things. I think the next thing we need to look at is your shoulder position. And it's a really good thing to do in front of a mirror, is to stand with your shoulders and try and work out where that neutral position is for you. So if you go all the way up and all the way down, your shoulders should sit naturally and quite comfortably somewhere in the middle. A lot of people will tend to find that dropped, and that's exactly when this area is put under tension and can create these problems. So up and down in front of the mirror, find the midpoint. Holding that midpoint, then go forwards and backwards and find the midpoint. And it will feel a bit strange at first, but that's where your shoulder should be. Again, if you're in the right place, you should find your neck movement is better and your pain is less. So you're getting some really nice feedback into what's happening. Let's look at the next side. So we can use exactly the test, holding the elbow up and just doing the movement. So what we want to make sure we're always doing is keeping the soft tissues and the joints below that moving through a healthy range. It's important for joints to move through their full range to keep them in good health. So by taking the muscle off tension, we're allowing that to happen. That's preventing issues from building up underneath that tight muscle. So that'd be step 1. Step 2, I think, is to actually then start to look at moving the shoulder. So find that neutral position, hold it, and just simply lifting your arm forwards and up without letting that tip of your shoulder drop down. What a lot of you will find is that as you're coming down, your shoulder will want to drop, which will add tension into here. So hold that neutral position and make sure you keep that tip of the shoulder at the same height and don't let it drop as you come back down. Now, if you break those exercises into your daily routine, maybe before lunch, do a little bit of work on your resetting and retraining, over time you'll start to change how you stand and sit naturally, and that will really help take a lot of pressure off your neck. So I hope that helps for those of you that have that related shoulder blade creating problems in your neck.